Mr. Howard Schiffer, Founder, President, and Chief Executive Officer of Vitamin Angels, Dr. Luz Escobil, Country Program Manager of Vitamin Angels, representatives of various non-government organizations, colleagues in the health sector, guests, ladies and gentlemen, good morning. First of all, allow me to commend the hard work of Vitamin Angels Philippines for organizing this Partners Alliance Conference. This activity is indeed very timely as we need to forge alliance to have a strong and cohesive response to health and nutrition issues, especially during this time of the pandemic. The COVID-19 pandemic has drastically affected the lives of families in the Philippines and the whole world. Many parents and caregivers have lost their jobs and livelihood. In affected local government units, many children are no longer receiving supplementary feeding in daycare centers and schools. In addition, many families are experiencing hunger or having difficulty consuming diversified and balanced diets, making all vulnerable to all forms of malnutrition, including micronutrient deficiencies. Malnutrition is a risk factor for complications in people with COVID-19 due to a compromised immune system. Although available information on COVID-19 indicates that infants and children generally present milder symptoms than older groups, we know that malnutrition increases the chances of individuals getting ill, staying ill, and dying. Malnutrition weakens the immune system, increasing the body's susceptibility to infections. The nutrition of pregnant, postpartum, and lactating women, including adolescent girls and older persons, are also of utmost concern because this cycle of malnutrition, infection, and deaths are exacerbated by the present pandemic. The enforcement of the enhanced community quarantine and the general community quarantine have limited the movement of people. Hence, provision of essential health and nutrition services by service providers and access to food and basic necessities by the clients are hampered. However, the DOH tries to emphasize to our partner local governments that routine and essential services should be made available to protect people of all ages, especially the most vulnerable groups, that of infants and children 0 to 5 years old, pregnant, postpartum, and lactating women. The Department of Health issued a number of guidelines and advisories to the local government units and other implementing partners outlining the steps of delivering basic essential health services following the minimum health protocols to ensure safety of both patients and clients and the healthcare providers. After more than a year of responding to this pandemic, it is also imperative that we at the health sector should slowly pursue the implementation of the Universal Healthcare Law to ensure universal health coverage for all Filipinos. Universal health coverage will mean that individuals and communities receive the full spectrum of essential quality health services from health promotion to prevention, treatment, rehabilitation, and palliative care without suffering financial hardship. Primary health care is the foundation of universal health coverage. It is a whole of society approach to health and well-being, centered on the needs and preferences of individuals, families, and communities. It addresses the broader determinants of health and focuses on the comprehensive and interrelated aspects of physical, mental, and social health and well-being. Nutrition is a foundation for health and well-being for all, leaving no one behind, and critical component of primary health care. Mainstreaming nutrition as part of integrated people-centered health services will put the comprehensive needs of people and communities not only for diseases and a critical, again, Mainstreaming nutrition as part of integrated people-centered health services will put comprehensive needs of people and communities, not only diseases, at the center of health systems and will empower people to have a more active role in their own health. Nutrition as a maker and marker of development is a foundation to the Sustainable Development Goals, especially SDG 2 and SDG 3. Healthy diets and effectively implemented nutrition-specific and nutrition-sensitive interventions will help countries to achieve these goals. Universal healthcare also involves the establishment of a service provider network, not only for the public sector, but with the participation of the private sector. This is where the Vitamin Angels Philippines and all its partner NGOs will play a critical role. Through your continuous support on advocacy and advisory services to support enabling environment, to technical assistance to ensure effective delivery of evidence-based nutrition interventions, and the increased availability of evidence-based nutrition interventions, women and children in areas where you operate, there is a high likelihood that individual and communities will be provided with essential health services. What we are facing ahead is not easy. Maybe some of the many aspirations we have may not be achieved within our lifetime, but I'm sure that important ones will be realized in the years to come as we heal, recover, and arise as one in the true spirit of Bayanihan. Today, I wish for the success of this three-day conference, delving on best practices and initiatives to improve delivery of health and nutrition interventions to our people at the primary care level. With your active support and collaboration with the government, we will be on our step towards breaking the cycle of undernutrition and ultimately promoting health and economic equity across the lifespan, especially for those underserved population. Ladies and gentlemen, we look forward and we remain inspired by your commitment in improving the nutrition status of the country. Thank you very much.